let me do, there it goes. Excellent. All right. Well, a lot of you have already started, but if you haven't yet, please introduce yourself in the chat with your name and your agency. You can add your pronouns if you'd like, or any other identifying factors. We do use the attendance in the chat for the HUD NOFO, so the Notice of Funding Opportunity application scoring process. So while that means nothing today, down the road when HUD releases their annual competition, we do check the attendance and there are points given for attendance. So please make sure that you get credit for being here by putting your name in the chat. I had shared that I don't think our first presenter can be here today. She had emailed me that she had, I'm just trying to scroll through names while saying things. I think she has a conflict. Is there anyone here from 211 that's able to do a quick presentation, or should we skip ahead? I'll pause for just a moment to see if anyone here. Okay, so I think that we should just move forward in our agenda. And if somebody from 211 is able to join us, we will backtrack. And if they're not able to join us today, we could certainly add them to an agenda on a different day. So moving on to the next item, Mandy Reagan will talk about the point in time count.
Good morning, everyone. Mandy Reagan, pronoun she, her. I am involved in some of the street outreach projects at BHS. So traditionally, I've been involved in the unsheltered count. So it is January. It is point in time season for us. So just as a reminder, although we talk about this all the time, I know you all are experts in it, but worth reminding, what is the point in time, or the PIT count as we call it. So it is a HUD mandated count of all individuals who are sheltered and unsheltered who are experiencing homelessness across the nation. It takes place within the last 10 days of January per the mandate from HUD. And for us, it's typically the last Wednesday of the month, and we are keeping consistent with that this year. The 3 COCs have voted that we will be conducting the point in time on January 25th, which is a Wednesday, the hours of which being 6 o'clock that night, all the way overnight into 6 a.m. the next morning, which technically is Thursday, the 26th. So for the unsheltered portion, we are looking at those that meet that definition of unfit for human habitation. And again, because it's an overnight count, traditionally here in New Hampshire, we don't have robust outreach teams that are out overnight for the point in time. So remember, for all of you that are participating in the PIT count, if you're going out and doing outreach on Thursday, the 26th, you're going to be asking where people stayed the night before. And if you're looking at your caseloads, you're going to remember that you're tracking those that are in the homelessness experience between the hours of 6 p.m. and 6 a.m. So there's been some confusion in the past about that, so just wanted to clarify that. In terms of the unsheltered count, we have been meeting with you all regionally just to check in and see how things are going and what your current PIT plans are for your unsheltered response. There's some ample and robust planning going on. So I'm hoping that I'm just looking down the list here. Some of you that have been planning these within your regions, if you could just give some examples about the efforts that you're undergoing here as we're leading up to the weeks of the PIT. And if I don't hear from anybody, that I'll just call on a couple of people, so be warned.
It's fine, Mandy.
How'd you know 3 weeks coming to you?
All right. So yeah, right now, like you said, we're all trying to plan, make sure that everybody's on the same page. So like, you know, as soon as we get the link training in the next few days, talking about the actual Google form that we will all use. Yeah. And then once we have the link in our hands, we can start making sure that all the community partners that are going to participate in the actual counting have that thing saved on their phones and are comfortable with how to use it. So we'll be reaching out and making sure that all our volunteers are ready to go and that their questions are answered. But for us traditionally, what the CAP team has done is from about 6 a.m. in the morning, we count until we leave work and make sure that anybody that calls in or visits the SSP or, visits the shelter, it's better to have duplicates than it is to have someone not counted at all. So, yeah, I don't know. Anything I'm missing that you want me to talk about, Mandy?
I'm so glad you mentioned the forum training because it will happen today at 1 o'clock. ICA is hosting that. So anybody has missed the link in their newsletter, we can send it out again just as a reminder, but that will go over unsheltered as well as anybody who does not enter into HMIS. So welfare or any of you other providers out there.
Yeah, and anybody that wants to volunteer on that day, please just reach out to myself or probably Connor Spurn or Owen. We'd all be happy to coordinate with you and get you feeling comfortable to participate in the count if you're interested.
And as far as the sheltered count, for those that are in emergency shelters or other locations, I will tag in ICA here because they really spearhead that side of things.
And actually, Susan just asked a question that I think Megan would be great for you to answer as well. I don't know if you saw that in the chat about shelters who do enter. So thank you.
Yeah. So Susan, this year we will again be using your HMIS data like you did last year and the year before. And we are having a live training on the 24th, I believe, specifically to show you what that report is going to look like, because it is going to look different this year than the past few years because we are in a different database. But yeah, you do not have to use the Google Forms for your data that you enter into HMIS. If you, though, are doing any outreach or come into contact with someone that is unsheltered, you are able to use the Google Forms to do that. We are pulling the HMIS reports this year because it's a new system and there are not a lot of folks that have looker licenses right now in New Hampshire, which we do recommend that at least one person do. So you're not able to even pull that report. ICA is pulling those reports. And Mandy, sorry, got distracted with the HMIS questions. So yeah, we will be going over the Google Forms and the paper survey this afternoon. We will be recording that, so anyone who isn't able to join the live session will be able to at least take and watch the recorded. We do have demo links for so you can practice and see what it looks like, the Google form. So if you've never done the Google form before, you'd be able to see, have some idea of what it might look like and what the process is.
Megan, are there links to those the demos that you could put in the chat for people?
Yes, let me find
Awesome.
them and I can do that.
Very cool. Oh, look, somebody else had the same suggestion in the chat. Perfect. And we will, when we send out the minutes, we will include those as well. And I just want to thank Freeman for the comment about it's better to have duplicates than not. Absolutely. Please. I would rather have you enter, even if you think somebody else already did. I don't need you to call and double check with somebody. Just if you have that person in front of you, do the survey with them, get it entered. I do some of the deduplication with ICA after the fact. So we take care of that part. You don't have to worry about it. Just get as many people counted as you can, because the better our count is, the better we can address the gaps in our system. Mandy, any other PIT comments or any other PIT questions from anyone in the group?
That was all I had. If anybody has any unsheltered questions, you can feel free to email me or send me a link. I will put my email in the chat. That was all I had.
Awesome. Thank you. All right. I still do not see anyone from 211 here. So we will move on to subcommittee updates for the day. Heidi, are you here? And your co-chair is Maddie, I believe, for the youth subcommittee.
I'm not sure if Maddie's here. Maddie, are you on this call?
She is. I'm not sure if she is prepared to do an update. So Heidi, could you start? And if Maddie's able to jump in, she can.
Totally fine. So we are working together to plan for our March coming up meeting. That will be a regroup of this subcommittee because we've been planning for the Youth Homelessness Demonstration Program grant, I think, for like a year and a half now. In terms of setting up projects, doing implementation conversations, and really just planning for this group to come back together. So we're going to be sort of regrounding ourselves and setting the stage for how we want to move forward in the coordinated community plan. We actually have physical copies of it now, so hopefully those will go out soon. And if folks would like the coordinated community plan electronically, Melissa, we can include it in the notes. I can give that to you as well. So there are lots of projects coming up, going to be starting with 4 agencies. And I think we shared this in the past, but the Upper Room has one, Waypoint has 2 projects. The Claremont Learning Partnership has 1 project, and Tri-County CAP has 2 projects. So they will be hopefully starting in the next few months.
All right. Anything else with the youth subcommittee? Looking good. Okay, thank you. Our next subcommittee update is coordinated entry, and that is Christy and Freeman.
I guess I'll go because I know Freeman's out doing outreach. I know he's here. Good morning, everyone. It's Christy from BHS. We have some exciting new things that are happening in the month of January in regards to the coordinated entry system. We are working on finalizing coordinated entry materials for all of the regional access points within the Balanced Estate Continuum of Care. I'd like to give a big thank you to Owen and Connor from BMCAP and the whole BMCAP team who helped assist us finalize those materials. We're hoping to get them printed and distributed out to the regional access points within the next month. They will have a flyer and also hopefully waterproof business cards as well, so that people have the information of who to call if they're experiencing housing instability or experiencing homelessness. We have our subcommittee meeting tomorrow at 2 o'clock. If you're interested, please send me or Freeman an email. We are also working on getting case conferencing up and running in both Merrimack and Belknap counties. We have a training for Merrimack County this afternoon, and Western Rockingham has their 3rd case conferencing meeting this month, and Belknap has their 1st case conferencing meeting on Wednesday. Don't think I forgot anything, but Freeman, feel free to chime in.
No, you got it. You got it. Yeah, no, Owen made the flyer beautiful, and Connor was an amazing help. So big thanks to CCEH for the collaboration. And yeah, it's a really nice flyer. I think will represent all of our communities well. It's eye-catching, and those waterproof business cards, I'm very, very stoked about, because everything of our clients kind of gets washed away. And our training for Belknap County case conferencing, I thought went really, really well yesterday. So we're stoked to have our first actual case conferencing next week. So super duper. Thanks for bearing with us, guys. We're doing the thing.
The only last thing is there's a revised draft of the coordinated entry manual that has been sent out to the subcommittee. Once we finalize a draft, we'll send it out to the entire Balanced Estate to take a look at. So.
All right. Anything else on coordinated entry? No? All right. Our next subcommittee update is the Veteran Subcommittee. And I don't know if Sean is here. Don't see Sean here. Mandy, I always go to you. Do you have any updates on the Veteran Subcommittee?
And Emily Racine, actually from the VA, is now the chair of it, but I don't see her either right now. So I can give an update. So the veteran subcommittees, they have combined across the state. So we used to do it that way, and we got away from that, and now we're back to that, just to solidify across COC lines and kind of standardize the approach that we're taking. So we had the statewide veteran summit last June, and from that, a steering committee was formed. We've been working on gaps that were identified in that summit ever since, as kind of goals to meet for the next year. So part of that was case conferencing. So we have been doing bi-weekly case conferencing that happens every Monday, the second and fourth Monday afternoon. So if anybody's interested in joining, you can send me an email and I will get you to the right person. But basically we go through veterans that are newly identified in our system, as well as those outstanding for getting into housing, and talk through as a multidisciplinary stakeholder group of how we can help them get into housing and stay there. Beyond that, for the veteran subcommittee, I don't think I'm missing anything. Katie, who's the chair of the Manchester committee, is also here. So if I have missed anything, Katie, feel free to jump in, but I think that's a summary for now.
I think you got it all, Mandy.
Thank you.
All right. And then Mandy, we will actually stay with you for the outreach subcommittee update.
The outreach subcommittee, we met, I think it was last month. Gosh, the months run together. We reviewed kind of the structure of the outreach subcommittee and where folks thought it could be helpful in the day-to-day, knowing that there's already regional responses happening. So we talked about having it be a training platform, as well as maybe some networking and peer connection. So potentially having a 1 or 2 in-person larger summits. So more to come. We are meeting bi-monthly for now. And I think more strategy and more structure will come from it as we work together. But big shout out to everybody who came. Definitely excited, feel the passion and feel the common mission that we all have, especially in light of some really difficult circumstances. So I appreciate your willingness to come together and have hard conversations to get through and serve those most vulnerable.
Excellent. Thank you. All right. So those are our subcommittee updates. This month, we thought we would try something new. And I didn't prep everyone. So if people from the different regions are not prepared for this, I completely understand. And nobody is going to be, nobody's going to be yelled at by me anyway. So I'm just hoping we can try and start getting more regional updates at this meeting, because the purpose of the Balance of State really is to hear about all of the great work that's happening across our entire geography. And since our geography is almost the entire state of New Hampshire, I thought it would be great to hear from folks other than just me every time. So I have the list that was created for the Housing Summit back in October, November. I can't remember exactly when that happened, but it was created for that purpose. I'm just going to go through in order and call out the different groups. And if there's somebody here who attends that meeting or leads that meeting that is able to give some kind of update, that would be great. And then I promise over the next couple months to actually reach out to all of you to be better prepared for next time. This is just a trial to see how it goes. So we will start with the Belknap County LSDA group. Is there anyone here who can give a brief update? I'm hearing crickets. Okay, we will move on to Berlin-Gorham Homeless Solutions Network.
Sounds like a job for me.
All right.
So we, over the last 2 months, have been focused primarily on the pit count. We right now have 4 pit stop locations, one in Colebrook with the TCAP Connect trailer, which I just got permission for. And then FRC in Berlin and Gorham, as well as St. Barnabas, are going to put some soup on. And then we've been doing that same thing across the different counties. But we're gearing up for that, and we're excited.
Excellent. Thanks, Eric. Okay, the Concord Provider Network. Is there anyone who could give an update for that one? No? Okay. Northern Carroll County Provider Network. And I think I got an update by email saying this meeting had switched back to Zoom. So I will update this to make sure it reflects that, and we can share this document again out with our minutes. Nobody for that group? Okay. Next is the Greater Keene Homeless Coalition.
Hey, how's everyone doing?
We're good, Craig.
So, good. So we have Kevin from MFS. We're down one outreach worker. So MFS, the path worker for MFS, is taking on the pit work in Cheshire County, and we have Jim Doherty, which is our ESG outreach worker, kind of taking the lead in Sullivan County. What's nice is that we had a community partners meeting last week, and I really told everyone, I said, you know, even if you think in your wildest dreams you may come in contact with somebody, and this is more than 30 or 40 agencies that is street homeless or literally homeless, have somebody in your agency be the contact person and reach out to Jim, right? Because as you said, Melissa, we don't want to worry about duplication. Mandy, thank you so much. Mandy has a list of the pit counts for the last 10 years. And it's very interesting for folks to take a look at that. You can really see the trends in our community. Now, whether it's because of how much we participated in it, or if it's really truly the way the economy is going or the demographics are going, but it's really something to look at. And so Sullivan County is where I've been kind of focusing, because we've had big zeros for the last few years. And I know that we can do better than nothing. So, you know, we're really focusing on that area. The welfare departments are helpful. We're reaching out to the social workers in the hospitals and also the SAUs as well. So other than that, SCS has had a whole bunch of weatherization work done and upgrades to our shelters. We're frantically trying to hire, like everybody else is, for another outreach worker and for a emergency housing coordinator in our shelters. And you know, I don't think it's a shock to anybody, but in 2020 in Keene, we served 101 people, and we served 193 in Keene in 2022. That's a 90% increase of the homeless population that we're serving. So I think everybody is really stretched very thin.
Craig,
Any questions for me, Melissa?
No, I just wanted to say I really appreciate you acknowledging that, because it's really easy for everyone to kind of get caught up in their own day-to-day, you know, just the busyness of our work, and acknowledging that we're all facing that, I think, is really important. So thank you for saying that. All right. Next on our list is Home for All. Is there anyone from the Home for All group that could give an update?
Sorry, I'm unmuting. Yeah, this is Damian Santana, and I work with Cara Rodenheiser and support the Home for All project through Grant United Way's work. So an update on a couple of things that Home for All are working on right now is we have a coalition meeting coming up on the 12th to regroup with area partners around a strategy for the next year to address homelessness on the Seacoast. We also have the Affordable Housing Incentive Program out on the Seacoast, which looks to incentivize housing for low-income tenants and families by providing case management through local area first-tier shelter partners and providing resources to landlords to help to avoid things like tenancy issues or eviction processes, or if those things are inevitable, how to sort of facilitate those to make them less burdensome on the landlords as well as the tenants. And other than that, I don't have any other updates at the moment.
Excellent, thank you. Let's see, sorry. Working better together, North Country. Give it a moment. Okay. Housing First for the Lebanon group. I thought I saw Lynn. Lynn, are you still here?
Hi, I'm here.
Hi, perfect.
So we have a new program operating this winter in the absence of a seasonal shelter in our area. The city of Lebanon authorized up to $100,000 to provide seasonal sheltering for up to 10 households in January and February. And we have partnered with the Upper Valley Haven, which is a shelter and homeless service provider in Vermont. And Cherry Sullivan is on the call from the Haven. The Haven is working with Lebanon Human Services to refer Lebanon residents experiencing homelessness to this program. The plan is to shelter them in motel rooms and have weekly supportive services provided by the Haven. And it's a very expensive way to provide seasonal shelter. There's enough money set aside by the city to book 10 hotel rooms, whether they're used or not, to make sure we have access to motel rooms. But right now, we've been fortunate that there are still vacancies, so we are not having to do that at the moment. And hoping that this is continuing to build awareness in our community about the need for shelter, as well as demonstrate that there are more cost-effective options than motel rooms. That's it.
Thanks, Lynn. And the last one on our list for the balance of state is Western Rockingham, Continuum of Care. Sorry, Angie, I can't say words today. Are you still
It's
here?
all good. It's
Okay.
a long name. Yeah, so things are going well down here in West Rockingham County. As everybody knows, we do not have any shelters. So a lot of our homeless individuals or families, they're either doubling up, couch surfing, or in their vehicles or trying to get into shelters within Nashua, Manchester, or even Portsmouth. Most families do not want to do that. So they're trying to see if other family members can take them in the interim. Our meetings are going great monthly. The case conferencing is going amazing. We've come up with a couple resolutions for some people. One is going to be joining the Job Corps. He's actually going to be going out to, I believe it's Montana or Wyoming soon. So we're helping get him prepared for that. Excuse me. And I did have a meeting with the upper room here in town yesterday with Brenda and Kara. So they will be joining our once a month meeting as well. To tackle homelessness within our county, as well as ideas for them with youth homelessness as well, because they've joined Heidi on that front as well.
Awesome. Those are excellent updates. Thank you.
You're welcome.
So that is the end of our list. I know that I didn't prep everyone that we were going to do this in advance. So I appreciate everyone that was willing to be put on the spot to give us a brief update. I will try to reach out to everyone that's listed as a chairperson to see if we could have people ready to do this next time. We did not add to the agenda a couple of things that I'm going to share, and then we'll go to an open floor. I believe most people know that the balance of state continuum of care was monitored by HUD some number of months ago. I think it was in July. It might have been August. We did have 4 findings from that monitoring. 2 of them were completely outside of our control. One was about the single audit for the state of New Hampshire, which is managed by, I believe, the Legislative Bureau. And we were able to get that one resolved by having our legislative team write the response and explanation about why BHS cannot choose the auditor for the state of New Hampshire single audit. So that one was resolved quite easily. We had a second finding about who signs the invoices, because there was confusion at the HUD level about the structure of DHHS and the finance team. So once we were able to send a flow chart over. That one was actually resolved quite easily as well. We have 2 that are outstanding, and we have submitted further documentation to HUD for that. HUD has informed us that they have to go to headquarters to ask about those findings. We were able to, with the support of our subrecipient agency, Stratford CAP, that was the project chosen this time, we were able to provide the actual federal regulation that shows we're able to use the funding the way that it was used. But our HUD rep would prefer to go to headquarters for confirmation first. So we are just waiting for headquarters to respond to them and then them to respond back to us. So we feel pretty confident that those last 2 findings will be resolved quite easily. It's just a matter of waiting for this chain of communication to make its way back to us. Chrissy, anything I missed about the monitoring? No.
The only thing that I would say is there could be a slight impact to subrecipient agencies depending on one of the responses from HUD. I also submitted 2 AAQs, which is ask a question to HUD about eligible expenses. So we're waiting on those responses as well.
We don't think it'll be a big impact. We just think that our HUD rep didn't understand the regulation we were looking at. And so once we get that resolved, we think we'll be perfectly fine, but we will update all of our subrecipients if there is a change. I think that is it. We still have not heard from HUD about the 2022 NOFO or supplemental NOFO for the rural and unsheltered homelessness. We're waiting patiently, but I expect it to be spring before we hear anything. So as soon as we get our funding announcements, we will certainly let everyone know. And with that, that was the fastest agenda we've ever worked through. So we have plenty of time for open floor. So if anyone has any updates, agency level or program level that you'd like to share, now is a good time.
Melissa, I put in the chat the link to Rockingham County. The emergency rental program has ceased on the CAP level, but Rockingham County, if you are dealing with people who are residents of Rockingham, they still are taking applications.
Thanks, Patty.
Thanks, Patty. Yes, they're still taking applications. My understanding is there's starting to be quite a long wait list before they're getting through applications because of the influx with Southern New Hampshire no longer having that funding anymore. So I have had a couple of clients who have applied and they're still waiting to hear.
Okay. Thank you both. And I do see Connor, your hand is raised.
Yeah, I'm on mobile, so I can't see. Is Karen Jansen still on here? Yes, she is. I just wanted to say we have a new executive director, and I don't know if she's been on this meeting since she started, but just wanted to shout her out. So Concord Coalition and Homelessness, our new ED is Karen Jansen. And so she's on this call. I don't know if she's right in front of her computer, but just wanted her to say hi.
Karen, are you here to say hello?
I am. Thank you, Connor. I think I was on the last meeting with Ellen. We were sharing a camera, but.
Excellent. Welcome.
Everybody.
All right. Any other program updates?
I just have a brief continuum of care subrecipient agency update. I know most of you know I'm working on scheduling all of your site visits for 2023. So look for those calendar invites. I will also be setting up several different trainings throughout the year and at least 2 subrecipient meetings as well. And just a reminder, and I'll be sending an email, but we still have open vouchers for the Moving On program. We have about 18 vouchers still remaining open. So please send me those applications for Moving On. And I'll be sending an email out with the application and information about it as well.
Excellent. Thank you. All right, last call. Any updates?
Hello, Melissa. This is Donna Harbison with the New Hampshire Harm Reduction Coalition.
Hi there.
Hi there. I'm not sure where it's appropriate to mention something that we're recognizing in our region related to housing instability. Would it be here or is there another section after this?
We are at the end of our agenda. This is just the open floor, so this is a good time.
Oh, perfect. Well, thank you all. I serve as the Director of Care Coordination for the New Hampshire Harm Reduction Coalition, and we facilitate the community care team meetings that happen in Stratford County and Eastern Rockingham County region. So we have CCT groups that meet in like the Rochester, Dover area, and then Portsmouth and Exeter. And one thing, it's been suggested by many folks that we bring this forward. We are seeing a tremendous increase in older adults or folks who are experiencing disabilities who are living in perhaps subsidized housing or independently, and who are facing eviction due to their inability to care for themselves. In Portsmouth specifically, there's a lot of talk about the public health aspects of what's happening, condemning apartments. Folks have been evicted just to kind of without a plan. And it, as traumatic as that is for that individual, and you know, their neighbors to see, and you know, the staff if it's in a housing authority. What we are seeing is many times this is related to medical components, the inability to care for themselves. It seems to get extremely tricky when there is substance use involved. So if a lot of that is due to their dependence on alcohol, there does not seem, or other drugs, there does not seem to be a next step. And folks in that region are really crying out for some help and looking to see like what we can do throughout the state, next steps, because this is only increasing. I think once the pandemic kind of receded a little bit, there was a window into what had been going on for those few years, and now folks are at the point where we're having elderly individuals evicted without a plan, without a place for them to go. So I'm curious, are we seeing this in other regions throughout the state? Is this more centralized? And I can put my contact info in the chat, because if anyone else has any kind of thoughts around this, or if maybe we should be talking about this more, it seems like that group particularly is pretty much at a loss. So thanks for giving me the opportunity to bring it here to y'all and see what we can do to support these most vulnerable individuals. So thank you.
This has definitely been something we've been hearing from our partners across the state. So I actually wonder if it might be a good thing to bring to the Council on Housing Stability as an identified challenge, because I think it probably includes, I know it includes more systems than just housing. But I'm seeing a lot of comments in the chat saying, agree, this has been going on for a few years, a lot of statewide challenges. Mandy Lancaster shared that this was the topic of a training yesterday on braiding resources, housing and support with ILS. Mandy, can you tell me what that acronym means?
Dependent living skills.
Thank you.
Yep.
Got it. I did not attend that training, but it sounds like it's definitely worth looking at. But Donna,
yeah, it was shared from someone here. I think Christy or Heidi may have shared the training. They forwarded it out. And it came from one of our national kind of partners with DHHS, and there's some there's like technical and training support around it. I'm sorry, that's as specific as I can get right now.
That's okay. No, that's
awesome.
good
Thank
information.
you, Mandy.
So Donna, I can, we actually have a council work group meeting this afternoon. I could bring this to that group and add it to our agenda as something to continue discussing.
Thank you.
Welcome. Okay, anyone
Yeah,
else?
Donna, thank you for raising that. We're definitely seeing that with, so we're basically a landlord, affordable housing developer, nonprofit organization. And yes, as we've been able to do more regular inspections, we've definitely been encountering some pretty horrible situations. And there really isn't, we're finding some people that are signed up with services but are not able to have as much support as they're supposed to have due to the workforce challenges. So we have one person who's supposed to get 40 hours a week of care, and he maybe gets 6. And he's just destroyed his apartment and keeps destroying his apartment, for reasons that are really beyond his control. But I think this would be a great thing for the council to look at, because in some situations, the only option that the landlord has is eviction, because there isn't, I can't make him go anywhere else. I can't make him go to a nursing home. I can't make him get any other kind of help. So the only tool that I have when faced with this kind of situation is often eviction, because some of these situations are impacting the other tenants that live around the individual. Like, there's a lot of health and safety issues oftentimes. And so yeah, it is difficult on the staff that have to try and figure out what to do, especially if the person's not responding to efforts to engage. So it is heartbreaking. And we'd be happy to be part of any conversation around this, because this is something that we're dealing with a lot right now. And it's been really difficult on everybody.
Thank you, Carmen.
Can I add to that as well?
Yeah.
I agree with everything that's being said. I currently am working with a 76-year-old man that we've housed, and we have put bees reports in. We've tried to get him extra help as far as keeping his house cleanly. And we're seeing a lot of cognitive issues with, looks like, early onset Alzheimer's, although I am not a medical doctor, but I did work on a dementia unit in a nursing home for 5 years. So I'm seeing all the signs, but even though bees went out and inspected his unit, they deemed him able to care for himself when clearly we're seeing otherwise. So it's kind of like all these resources we have, our hands are tied, even though we're trying to get them the help that they need.
I don't have a ton to add, but we've had very similar experiences with bees.
Okay, I'm adding it as something to bring to the council, because as you're all talking, it does sound like it's a multi-system situation. And the purpose of the council is to bring together all of those systems. So I think let me get it to the leadership of the council, and then I can certainly send an email to this group to let you all know if it ends up on an agenda in the near future. Okay. Any other updates from anyone? All right. Well, hearing none, you have all just gotten an hour and 15 minutes back in your day. So that was a very quick meeting. Like Christy said, we will plan some trainings for future meetings. So that'll take up a little bit more time. But in the meantime, I hope everyone
I had
has.
a quick question. Sorry,
Sure.
I just
No, go
hopped
ahead.
on late. I'm Dave with Easter Seals Veterans Account. I cover the whole state, and I'm seeing a lot of people on this meeting I've never even met before. Is there any chance there's like an overall directory for everyone that's in this that I can get, so I can reach out and try to connect with the various people in the different parts of the state?
I have a rather large email list that I could probably share. I don't have it in a great format for sharing yet. that is something that I would love to do. Like I would love to have it set up so it has like agency, the name, your contact information, and I just haven't done that yet. So, let me figure out a way to get that to you, because I do think that it would be worth having contact information for our network.
Thank you so much. That'd be very helpful because I'm just basically winging it when I go to different parts of the state and going, who do I talk to out here? So that would be definitely be very helpful to have a contact in each region, and if we can
I
kind of
wonder,
collaborate.
maybe you could start with the regional leads of those meetings, and then they could maybe introduce you to some of the folks in those areas. And you have that meeting set up already, Melissa, that you maybe you can put with the notes again.
Yes. Yep. I can put that in the notes. And if you put your email in the chat as well, that will help so we can get everything. So I can send it to you, because I don't know if I have your email address saved somewhere that I know. I'm sure it's in a list, but if you put it separately, I'll be able to access it easier. So,
I'll put it in the chat. No problem.
perfect. Thank you. All right. Anybody else? All right. Well, on that note, we can end for today. And I want to thank Emily Whitaker. I don't know if she's still on here, but she's helping me with minutes today. So you will actually get minutes from me in a reasonable time. So thank you, Emily, for joining us today and taking our notes. I really appreciate your help. And with that, thank you, everyone. I'm going to stop recording, and we will see you all next time.